Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne, on scars, pigmentation, and facial balancing. And I want to go through this case. It's a really nice case with a patient with rolling scars and talk a little bit about how I fixed those scars. Also answer some of the questions that I've gotten over the last few days and especially on the lives that I didn't get a chance to get to. So I'll be able to help out a lot of people that are concerned with their skin. It doesn't necessarily have to be that they are concerned about scars, but they also request, questions about pigmentation or about fillers. I'm hopefully going to help with answering some questions with lasers in general and what it can be used for, what it shouldn't be used for, and kind of walk you through just how I did this particular case, which is nice because this is a result that we can achieve with subcision and with some volume replacement, lasers, of course. But you can see with a patient who is of darker skin type, she's a Hispanic patient, we were able to achieve amazing results. And what's also really, really nice is you can see that we didn't cause any real pigmentation issues. She actually had hyperpigmentation before I saw her, and afterwards, actually, that pigmentation got better. So really nice. A lot of people would say that you can't treat darker skin types. I hear that pretty much every single day where someone says that you can't do darker skin types, but here we are, we're able to do that. Numan is saying, hi doctor, the pigment control cream I bought from you guys is irritating me and making me very red. What should I do? Use a lot of moisturizer for that first week, especially just use a pea-size amount or half a pea-size amount initially. Mix it with some moisturizer, get used to it first, and then you should eventually get to be able to use that. Okay, I use it every single night, so it's doable. You just have to just get a little bit used to it though. Hi Joey, how's it going? How do I fix hollow eyes? Well, it depends if it is an area where you lost volume, but you don't have like too much skin laxity right there. Then what you could do is actually just a little bit of filler. And especially you could do actually something where you put a little bit of filler in the mid cheek first and just tiny little bits along the bone underneath the eye area that's called the tear trough area. And I usually do it on the bone area so that way it doesn't migrate, and that tends to be my way of doing it. Ken is saying, I have Fitzpatrick 5 skin and I finished peeling from a TCA 20% peel. I have a shadow on my face. Yeah, Fitzpatrick 5 with even 20% TCA, usually it should have been mixed with some sort of skin lightener. So it's concern that wasn't done for you. That being said, at this point, you're going to have to do something to help with the hyperpigmentation. You could try something like over-the-counter Eucerin anti-pigment cream could potentially help you, but over time, you may need to do something that's a little bit more aggressive, like the Pico laser. For those asking about consultations, appreciate you, by the way. Thank you so much, Serenity. You could just go directly on my page, drqazi.com, and you could schedule a consultation just like that. And you don't have to be local. We do a lot of patients that are from overseas or out of state. Most of our patients are out of state, actually. And we go through all this really in-depth just with a virtual consultation. I'll be happy to break it down for you. Bird Bash is saying, I want to dissolve some cheek filler Voluma because cheeks are too large. What are side effects of dissolving, and can you take it slow to dissolve better? Yeah, that is actually my approach. Today I worked on a patient who had 15 vials of Voluma and something with Restylane. She wasn't sure which kind of Restylane, but she had 15 vials of it, and it was really, really puffy. And interestingly enough for this patient, a few things that were actually very interesting. One is that when they were injecting, they also inject at her eyelid. That was like all the rage in like 2018, and that's around the time that she actually did that. And she thought that she had hooded eyes. She actually ended up getting a blepharoplasty, and the surgeon should have double checked to see if they had filler over there, but they apparently didn't. And she did a blepharoplasty, and then it was still loose afterwards. So, I ended up dissolving filler now that was like 8 years old or so, and above the eyelid and the eyelid. Also, her under eyes were really swollen and puffy. Dissolved her mid cheek. So different areas I worked on, and then in the future, because there's so much inflammation, we could do this in stages, and then we'll just go ahead and do it again. But that's usually my way of doing it. I do it with the ultrasound. I'll take a look to see how to map out where the big chunks of filler are. And then in a lot of those areas where it's like I need to go those discrete those little hyaluronic acid bubbles, I'll go with the ultrasound directly at those spots and dissolve it. And it's amazing. You can see the instantaneous improvement right there. So that's how I could avoid like excess inflammation too, and just other problems down the line. Just go right at the actual source of the problem. And so I do a lot of dissolving. Actually, 2 good cases of dissolving today, and that's really again, I've said it before, but the problem is that people were overfilling for a long time. They were saying that these fillers are just lasting a year, and sometimes they're lasting a decade, sometimes they're lasting decades. So clearly, just thinking that hyaluronic acid filler is just temporary isn't really true. It could be dissolved, but sometimes some of these fillers are really, really difficult to dissolve. Like Volux, the new Juvederm line with Volux is very, very difficult if it's placed superficial. Yes, we could ultimately dissolve it, but it just is extremely costly. It takes a lot of work to dissolve it. And Voluma is also really difficult, so tough to do. Hi G, how's it going? Thanks for answering that question. Yeah, so most patients spend about $5,000 to $7,000. Some patients spend a little bit more depending on how much volume loss there is. This patient, she did have more volume loss, which we had to work on with Bellafill. So she ended up, we did talar liberar subcision, we did TCA Cross, we did CO2 laser, and then I also did some Bellafill the day of, and then I also subsequently did a little bit more Bellafill for her. And it's amazing, impressive results. But like I said, the biggest thing also, which is really interesting, is that she doesn't have excess pigmentation now. She doesn't have hyperpigmentation, so it's awesome. I love it. I love the fact that we're able to showcase this over and over and over again. And everybody will tell you, well, up until now, they were saying before that you just can't treat these type of this skin type, or they'll try to pretend like in order to treat this kind of this skin type, you have to do, microneedling, or you have to do like Fraxel, you have to do things that just are not that effective for it. A lot of people are pushed to do like just devices that aren't too effective. And here we did actually, for some of those spots, I did do fully ablative CO2 right there. The volume restoration near the temple is a home run. Yeah, it really is. I always say I'm a big believer in Bellafill along the temples, but if you don't want to do Bellafill, you could do Sculptra, do fat transfer, do something for it. Volume in the temple area is a huge way to improve that skin. It's not about high heat, high energy, especially over there. So definitely I would help with the temple area with volume replacement. Numis, or I'm not sure what that is, but I've been pushed to do microneedling. Why doesn't it work? Well, it's pretty mild. It's not going to help out too much. It can stimulate a little bit of collagen, but not going to help too much really for vast majority of these kind of scars, especially these thick ones right here. How do you treat her grid marks post laser? Well, usually it's with, first of all, just with time, just moisturizing time. Sometimes you can see the grid marks more if there's more oil production afterwards. And so you really want to suppress oil production. If you can suppress the oil production, you're less likely to see that. Things like topical retinoids, also potentially even oral Accutane if you need to, because if it's excessively oily. But within that first month, even 2 months, you could just have a more oily skin. And that could end up being the problem. Am I a medical physician? Yes, I am a medical physician. I kind of like, a lot of people say doctors. I just say physician because it's like, I think people know what a physician is. People sometimes don't necessarily know what credentials someone says as a doctor. But I like to just saying physician sometimes. Bird Bash, is it better to dissolve the Voluma earlier, like after 1 month, or is it better to wait longer to dissolve easier? No, it's definitely better to do it earlier. If you ran into problems with the filler, better to dissolve it earlier, because like this patient that I'm working on right now, she's likely going to have some laxity after the filler because the filler was misplaced. It was too superficial. It drew in too much water. And then what ends up happening then is that it stretches out the skin. And sometimes that skin can contract, but especially for this patient, she's a little bit older, it's going to be looser now. And then, this is old filler there that's sitting there in loose pockets, and you just really now cause some structural damage to the skin now. And of course, there's things that we could do to improve it, like lasers, things like that, but better to avoid that, right? Let's see here. I'm a second year at USMD. Should I do derm and love surgery though? Oh, hey, Tom Brady. Yeah, good question. I don't know. What are you trying to go into? What's your thought process? What are you trying to treat? What is interesting for you? I think that's really what the big question is. You said you like surgery. I think do the rotation for surgery, see if you like it really. Everything is about just like what speaks to you. When I, actually, it's interesting. Someone on here is actually asking what made me go into medicine. Also, I don't know if it was you just earlier that asked me too, but for me, the reason why I went into medicine was actually because I love to problem solve. It was actually really, really amazing to just have something like a career where I could problem solve. And like this to me is solving a problem. It's like constantly a puzzle. And I'm using my hands to do it, which is really fun for me because I really love to work with my hands. You can see a lot of times I talk with my hands. I just do a lot with my hands. I learn with my hands. And like I touch and feel skin and I can memorize that really well. So it depends on what you do really, really well. Everybody learns very, very differently. Some people are excellent at just telling the difference between different images, and they may be better suited for like pathology or like radiology, whatever else that could highlight those skills. But it all depends on what really is interesting for you. For me, I look at things as like a puzzle sometimes, and looking at it, every single patient is just really fun because I look at it like, how am I going to solve this particular scar? How am I going to solve it on this particular patient? And it's interesting for me, so I like that. You may be different. Maybe you like the surgical portion of things because you just like doing the procedure, and then you're done with it and the person's healed and you can move on. It all depends on what you find is the best for your learning style too. Can you completely remove them, or do you just reduce the appearance? Some more superficial scars could be more removed, like relatively easily. But the deeper ones, it may just take a lot more work. You may need more volume replacement, things like that. It's tough to say, but some of them, more superficial ones, yes, we could potentially remove those ones over time. Vika Nguyen is saying, what's the best first step for facial maintenance? Should I start with laser treatments or chemical peels? Honestly, I just love lasers. Nothing really beats it in my mind, but you could do, if you're the right skin type, you could do like TCA peels. That's nice too. It's just that they could be a little bit more variable. You saw somebody on here who said that they're Fitzpatrick 5 and now they have post-inflammatory hyperpigmentation after the TCA peel of just 20%. So, there could be a little bit of risk depending on where you're going to. Of course, lasers also. But I like lasers. I do lasers on my own face like every 6 months, and it's just like I do notice a difference like really like 3-6 months later. It's awesome, and I just keep on doing that. It's like a cumulative effect for me, which is really fun. Anjay is saying, what procedure was done here? This is with Subcision. This is with TCA Cross. This was with Bellafill. We did ablative CO2 at the edges of the scar, and she subsequently came back for a little bit more Bellafill and some more TCA Cross as well. So we'll keep on chipping away. There's still a little bit of volume that I still have to improve, but I liked it a lot. It's a really, really nice. She's super thrilled, super happy. She said it's better than she ever expected, which, is really nice to hear. Birdbatch saying, can you just dilute the dissolver with saline to have less side effects? And how many days does it take to see improvements after dissolving? Do you recommend adding new filler to cheeks or doing lasers? Good question. There's a few elements there. So can you dilute the dissolving agent with saline? Yes, you could if you want to, but I don't know why you would do that, because it's just spread in areas that you may not want it to. Unless it's just a lot widespread area that you have to cover, then sure, you could dilute it that way. But otherwise, though, going to discrete pockets of filler is actually a little bit more valuable, less chance of like more inflammation. So I would just go right into those pockets right there directly. So I don't necessarily want to dilute it. Do you recommend adding new filler to cheeks or doing lasers? Well, it depends on how much volume loss there is. I found that a lot of people were pushed to do filler in like the mid-cheek area, and it was really catastrophic for a lot of patients. It really was. They were just telling everybody to do, oh, you have some deficiency in your mid-cheek, you need filler here, and they were like telling everybody that it's going to lift up the face, it's going to be like a facelift, it's all this, and they ran with it for a long time. So many different influencers in this side of the industry were pushing this stuff, and we're making all sorts of claims. Now they claim that they're all about natural stuff, which is kind of interesting and hilarious to me, because for the longest time they were just pushing like fillers, 6-7 vials on like the upper face, things like that, and they're like, oh, if you don't do this that way, it's not going to work. And everybody was going viral with showing that like filler was just like the equivalent amount to like a ketchup packet. But it was really disingenuous because, and like frankly manipulative by some people because I think they did really know better. You know that like hyaluronic acid has different structural composition than ketchup. So even if a packet of ketchup, is just a very, very small amount, it's not going to actually absorb in the skin. It doesn't draw in water the way hyaluronic acid filler does, in particular, certain kinds of hyaluronic acid filler. And then the other thing that was really concerning is that they were making the claim that you should put a lot of these fillers with a cannula in the mid-cheek, relatively superficial. And now we have a patient right now today, which I dissolved, and it cost a lot of money to dissolve that. And it's like, that could have all been avoided if they did better practices without like these superficial pockets. And if people weren't influenced by a lot of these people that were bought by the companies, really. And they're proud of it. They openly say that they were bought by it, that they're the key opinion leaders in some of these companies. And, they pushed a lot of stuff that was damaging for a long, long time. Really, we're seeing the consequence of it. And it's really unfortunate because, there is a role for filler. There definitely is a role for filler, but the pendulum swung so much away from that now. People are like so scared of filler, but this patient, she got filler. What else are we going to do for a volume loss? Of course, we did Bellafill. We had to do something that stimulate collagen production. We had to do that. I'm okay with doing Sculptra or Radiesse, something like that, but like we have to do something for volume. So that's what we did, and you have to do that. There's no other way around it, really, for this case. Like if we smooth down all the scars, everything like that, what are we going to do for that big depression? You have to do something where you could do something like a Bellafill in this case. Can you do a laser in Fitzpatrick 4 through 6? Yes, this patient is 4 through 6. Most of my patients, the vast majority of my patients are Fitzpatrick 4 and above. Vast majority of my patients. I could easily treat Fitzpatrick 1 through 4, like easily, Fitzpatrick 1 through 3, I should say. Very, very easy. It's not, the challenge really isn't with using like just lasers and energy devices. It's doing combination of different things. But when you're doing the laser in lighter skin types, there's less concern that you would have for certain patients for getting post-inflammatory hyperpigmentation. You got to really, really pay attention to those things. So some patients that are darker skin type, it just takes longer. It may take longer to do because we may not be able to push the energy devices the way we could in lighter skin types. And everybody knows that. Everybody should know that. We're going to keep you safe. We're going to get you that result, but it may take a little bit longer because of your skin type. Can Radiesse be used for volume loss? Yeah, absolutely. Radiesse is excellent for volume. It's a calcium-based product, so it gets fully absorbed, completely natural, really. So you should definitely consider it because if you're concerned with any other kind of filler, you don't want anything else foreign in the body, etc., well, use Radiesse, which is a calcium-based product. It's excellent for you. Can you push your skin to new limits? Can your scars get better? Yeah, absolutely. We'll see her again. We'll put a little bit more Bellafill there, TCA Cross, and likely do a little bit more laser as well. Just joined. Venus has just joined. She's saying, how was this achieved? This was achieved with talar liberator subcision. So subcision means I went in the skin, broke up the scar tissue. So there's a lot of new people, so I'll go through things in step by step actually for you. So there's a few things. Actually, let me try to make this photo a little bit bigger so you can see some parts of the scar a little bit better. So hopefully you can see it a little bit better this way, although I think I blew it up too much. Let me see if I can go this way. So what happens here is you can see there's hyperpigmentation. There's also a lot of these thick edges of the scar. There's these rolling scars and a lot of volume loss. And we had to basically do a few things. What we did was we went underneath the scars and actually broke up the scar tissue manually, something called subcision. And there's different forms of subcision. There's something called blunt candle subcision, which I mostly do in some patients in some certain areas which are really stuck. We may have to do something called talar liberator subcision, which is a little bit sharper. And I go at each individual scar that I have to with something like that and break up that scar tissue. So that's one part of it. And then I also did a CO2 laser, fully ablative CO2 laser for the thick edges of the scar. I also did something called TCA Cross. I put that inside the deep parts of the scar. And then I blended it in with an erbium laser. So I did a few different steps, really. And then on top of it, we wanted to make sure the pigmentation was okay. So we basically had her so that she did a skin prep before we did the treatment. And we did all that just really easily for this patient. I shouldn't say necessarily easily, but she told me that her recovery was really easy. So that's all I meant easy. I was thinking in my mind, easy because she said that the recovery was not too bad. Let's see here. Do you have any keloid scar before and afters? I'm sure I could pull some up there. Yeah, I'm sure try to find some keloid results for you. I'll be happy to do it. How would you typically treat skin with larger visible pores? Is it possible to shrink the pores? Well, you want to control oil production, so tretinoin is a good idea, or if you want something topical, something like adapalene could potentially help. It's not going to be like the complete solution though. You could do like microdosing of Accutane if it really is bothering you a lot. The cure laser also helps with pores as well. So reducing oil is really the first step. But double check though for someone like me to see if it really is truly acne scars or if it's pores. I had a patient actually, a dermatologist locally referred the patient to us. She had on her nose what she was told for a long time was pores. And they sent a patient over to us that it was actually what looked like more like scars. True enough, it was actually scars. And so I worked on it, and that's what I could do. Actually, for the longest time, she was told that this was, she told multiple dermatologists apparently in the past that there's nothing you could do. It was just pores. But finally, she went to somebody who recognized that this was actually scars, and then they sent them over to us, and we were able to work on it. So it's like, it's sometimes tricky for people. They think that it's actually professionals actually too. They may think that these are pores, but they're actually deep ice pick scars. So interestingly enough, and it's nice that when it is recognized, it's like, okay, here's the best treatment. You should go to this physician because he's going to be able to treat your darker skin type. She's a Hispanic patient, and we were able to manage it though with TCA Cross and with laser for her. What do you think of Subcision with fat grafting for rolling acne scars? I love it. It's a great option. I just don't do it the same day. There are people out there who do it the same day. It's really reckless. I've actually have done revisions on this on these patients where they've gotten it done where they did Subcision, and then the person there's like a couple of people that seem to be doing a lot of fat transfer the same day that they do Subcision. And over again now I've dealt with patients who've had lumps below the area that it should have been, because it was like when they placed the fat, it seemed like it was one layer, but now because you did Subcision, you undermine so much, you don't even know where you place that fat directly, and it went with gravity to the path of least resistance, and it caused like this big lump there in the lower part of their face. So definitely something to pay attention to. I don't do it that way, and I think you should probably question if somebody is suggesting that they do fat transfer at the same time as Subcision. Just double check, because I've seen a lot of problems with that, and I don't do it that way. And it's like I don't run into a problem where these lumps occur elsewhere. So just double check. Make sure that it makes a lot of sense for you. Thoughts on beef tallow? I know it has apparently has some vitamin A in there, which sounds like it's probably going to be okay for people. But I had some patients that said it broke them out. I saw a lot of people that were saying that there was like an Amazon affiliate link when they were trying to push beef tallow. So it's tough for me to really say if it's really like actually helpful or not. I was actually going to try it, but like then I was kind of too scared to try it because some people were saying it broke them out, and I didn't really feel like just like trying something that was going to break me out right now. Maybe if I have some downtime, I'll be okay with it. Like sometimes I'm okay with trying like different random creams, but for some reason about this beef tallow thing, I'm just worried that's going to break me out too much. So I have been like pushing this back. Maybe at some point I'll do a little experiment, and we'll see if I break out afterwards. T-Chan, how's it going? When is the ideal time for second phase of treatment? Is there a difference between waiting 3 months or 6 months? As long as your pigmentation is okay, like the redness is under control, there's not much with hyperpigmentation, we could do it in 3 months. It's totally fine to do that. Birdbash is saying, can you just remove some of the cheek filler, or do you need to remove all of it? How long will it take to see improvement after dissolving? Well, it depends on where it's placed. If you're talking like some pockets in like the mid cheek, yes, we could remove some of those. We'll save like maybe your lateral cheek or something like that. But sometimes it's difficult to tell what's the issue. Why is it like looking more puffy and swollen? And ultrasound is definitely going to help though to map it out. And yes, you see improvement right away, but then there's also inflammation that first day. So I would usually wait like 4 or 5 days to take a look and see that there. What's your view on microneedling for collagen induction in ethnic skin? Does getting to the dermal layer make a difference? I don't think it's too helpful for the vast majority of patients, really. I don't think so. This patient, Fitzpatrick 4, Hispanic patient, we were able to achieve this with the Hispanic patient. And over and over again, I show Fitzpatrick 4 and above. Can you do subcision more than once? Yes, you could. If you need to do it, you could do it more than once. Are there patients we've done it more than once? Of course. A lot of times though, it's volume loss, not true like tethered bonds now. You just have to solve that fat or volume and do things with like Sculptra, Bellafill, Radiesse, do something like that, and then stimulate collagen as well. Or fat transfer. What do you think about fibroblasts? I had it done a month ago and I still have red dots on my face. Do you know how I can get rid of them? I think it's a terrible device, to be honest with you, for like vast majority of, unless it's like a little small skin tags, things like that, sure. But I don't see what the utility of it is. Those little red marks, at least they're red, they're not hyperpigmented. At this point, you're just going to have to moisturize that, to be honest with you, and put a lot of sunblock there so it doesn't turn hyperpigmented. Was this done with one session? Well, it varies. Basically, there's one bigger combination session, and then we did Bellafill afterwards and a little bit more TCA Cross. So it's a couple different steps, but not the same thing over and over again. I missed my spot here. Let me try to catch up here. Is this a permanent result? So the texture is permanent. You get to keep that. You are going to still experience some volume loss as you get older, and we are likely going to have to keep up with doing a little bit more volume. Nobody wants to hear it. Everyone wants to say that like volume is just going to last forever. It just never lasts forever. You could lose fat, and we have to place a little bit more volume in there. The product name is Acne Scar Treatment. It's not like an actual product name. I don't have like a thing for it, but it's just Acne Scar Treatment. Basically, I did a few things for this patient. I did Subcision, TCA Cross, CO2 laser, Bellafill. So those are things. I saw a few things. Let's see if I could try to catch up with the questions. I'm sorry if I missed. There are a lot of questions that I missed. So if I missed your question, I will be happy to help you. For falling hair solution, well, double check your labs. Sometimes anemia could be a factor in this. Sometimes vitamin D deficiency could cause this. Hypothyroidism could cause it. So double check all those to make sure there's not some internal reason for you to have losing your hair. Then assuming all that is under control, no real problem with that, then you could do something like a topical minoxidil, and there's no real difference between the woman's one and the men's one other than the price. It's like what they call the pink tax, which is like sometimes women's products are just more expensive for whatever odd reason in this world. I don't think it's in the world, I think it's just this country. But just stick with like the men's one, it's perfectly fine. And then you can also do PRP injections. PRP injections work really well just to actually prevent more hair loss, stimulate more hair growth. So you consider that as well. So a few different other things that you could do. Of course, there's hair transplant. Timur is saying, hi doc, how many TCA cross sessions do you usually perform for ice pick scars in general? It could be like anywhere from 4 to 6. Some patients, if it's very deep, it could take like almost 6 to 8 sessions. Sometimes it could sometimes take a lot longer than people think. Timur saying also, could you say how long you usually wait after treating ice pick scars with TCA Cross to evaluate results in your patients? Okay, so I have a patient today that just came in today. He comes in all the way, like I think 3 hours away. Usually he drives in for me. I've been seeing him for the last 4.5 years or so. And he told me really for the first 6 months, I was getting messages from him for like 6 months that he was hardly seeing improvement. Then I stopped hearing from him for a little while. He drives so far away, so I didn't really see him. And then he came to do a consultation for next steps. And he's like, it turns out it took a while. It was a year really for him. And it's like, I didn't get to see him for a long time, for like really that first year. For the first 6 months, we're just hearing over and over. And then he said, yeah, there was. Then I started to notice it was getting softer. So I was like, okay, I started seeing the improvement. And then when he started all that difference, then he's like, okay, now it's time to come back and make that trek over here again. He started to realize that. But if you're local, if you're able to, as frequent as we can, we could do that every few weeks if you want to for TCA. It's really, really excellent to stimulate collagen, continue to break down the scar, and over time you are going to get that softening effect. It is a lot slower than people expect though. But there's no harm in me doing it multiple times before that full year. I don't know why we wouldn't actually. In fact, there was a study, it was kind of like not a huge study or anything, just a few patients, but there was a study that showed that doing it every few weeks actually did have really great outcomes. And so sometimes I do it that way. If I can get away with it, try to do as frequent as I can. Otherwise, if you're out of state, what I do is I combine that a lot of times with lasers, and I try to go a little bit more aggressive for you so that we can make it worth your while too with that whole trek. But depending on your skin type and whatever else, and if we're able to do it that way. So there's ways to work around it, but if you're, someone local, if you're able to travel multiple times doing TCA Cross, really beneficial. Nothing beats it for ice pick scars. It's not about, just lasering a lot of those times, just constantly placing TCA, just constantly putting it over and over again. It's like literally this patient today, he knows who he is. Sometimes he comes on too, and really nice gentleman, but he comes in, I think it was like 3 hours away, and I've been seeing him for 4.5 years now or so. So it's awesome. It's close to scars. Actually, his story is really sad, and it's a sad story actually for him. He didn't actually have acne scars. His story is sad because he says that he was not informed properly. He had like a little bit of pigmentation issues or so, and in the 80s he ended up doing a chemical peel. He said maybe it was a physician, I can't remember exactly, but someone did a peel on him. And the peel was so harsh for his skin. And he's a darker patient. He's actually Fitzpatrick 5 Hispanic patient. He was darker skin type, and it caused severe scarring. Actually, it looks almost like acne scars. And he was crushed about it, devastated, because if you think about it, he said he was just in his 20s, and he viewed himself as like a handsome guy. Otherwise, like was like had a certain image of himself, and it was just crushed and been crushed for a long time. He went to multiple different people to try to fix it, and now it's like as smooth as it possibly can. So he said one day maybe he'll let me share results one day, but let's see. I stopped asking because he said, I don't want to be too pushy with that thing, but he said maybe one day he'll share it. But it's pretty close, which is cool. Would you recommend Secret RF or Pico Fraxel for acne scars? Well, Fraxel Pico would probably be a little bit better for acne scars. Secret RF would be lower on that list. I would not recommend it for that. I don't recommend, in general, radio frequency microneedling. Thank you guys for the watermelon emojis. Thank you. You guys know what's going on, hopefully. Everybody knows, right? Yeah, everybody knows at this point. And like I saw a lot of people are upset with it now, but they were quiet about it before. But like, it's really time to speak up about this stuff. Like, there's still room to like just stop stuff. Like, it's just like, we really do have a responsibility. We have a lot of responsibility. It's just like, it's really, really like outrageous. It's really beyond like anything that you ever imagined. Everything that you thought could be like as bad as it possibly could be, it went worse and worse. And that's why I didn't post anything about the ceasefire or anything like that, because it's just like, I knew these are very, very dark times. And it's like, yeah, it doesn't matter. I'm not Palestinian, and it's like, it doesn't matter. It's just like, there's a lot of human rights issues out there right now, and everybody needs support. It's like they want to divide everybody. They want cultural wars. They want people just to sit there and worry about left versus right, all that stuff. Don't worry about any of that stuff. The truth of the matter is that trans people are under attack, homeless people are under attack, migrants, refugees, all these people are under attack, and it's time to really just start stepping up. Start stepping up, and like, unless we do this, unless you guys start like waking up, and I'm not saying like just I'm not just saying like just like saying it on here, although that helps. I'm saying like actually like pay attention to this. It's really, really dark times, like properly. And I've been talking about it for a long time, and a lot of people on here know about that. But I think that we're in a very, very, there's a very, very short window of time before things could really change even more dark for us. And we have like, a little bit of room here to kind of turn things around if you want to. It's up to you guys. Part of this is just like, I'm only one person. I'm just a doctor. And, a lot of this is satire, maybe, So they said one time they were like a thing where they were making fun of Puerto Ricans. And he was just like, oh, it's just a joke. So I guess like, just in case anything I say is offensive to people, just remember it's satire, guys. It's satire. I'm going to throw that out there. I'm going to put that on my thing. It's just, I'm a comedian. There we go. So that way we're always going to have a safe space. I'm a comedian over here. How long do I have to wait to see you after Accutane? It depends. It depends on what high dose it is. It could just be a lower dose, really. You don't have to actually necessarily have to wait. I could do it while they're on Accutane. You don't have to actually, you don't actually have to stop Accutane for a lot of these treatments. Even like a laser treatments, things like that. It's okay. In fact, I like the fact that there's less oil production sometimes. I want a really low dose of it sometimes. And a lot of times patients are put on too high of a dose for it. I like microdosing it. So is TCA Cross only for ice pick scars? No, I do it for boxcar scars. I even do it for rolling scars. It just depends on what happens with these how the scar is going to respond for me. I know that for some scars, I just want to get a little bit of tissue contraction. I don't necessarily want it to, I don't expect it to necessarily rise too much, but I'm trying to narrow it a bit. So I sometimes do it like that so I can get a little tissue contraction. Soul Matcha, how's it going again? No, this was basically one bigger combination session, and then this patient did do Bellafill, wink, wink. And then also we did some more Bellafill on her, and then a little bit more TCA. Saying wink, wink because I tell patients all the time to do Bellafill, and sometimes, not saying you gave the resistance, but a lot of times people do say that I'm not so sure if you really need the volume loss, but like it really is critical for so many people. It really is critical. Like you gotta do something for volume. Otherwise, it's like you're just like retexturizing all that stuff, and you're not changing anything. You're not going to change anything really, unless you solve that pocket of volume. Doc, what's the maximum amount of Bellafill you have used on a patient's face over all their sessions for volume loss? I guess I'm the kind of person, I don't know, I have to count how many vials of Bellafill I have one day. I gotta see. I've done like a lot of Bellafill. I'm not sure what that number is, to be honest with you. I gotta double check. But I've had some patients in like their butt, for example, like 30 to 40 vials or something or so that she's done. It looks amazing. It's a great butt. But on the face, I'm not sure, like not like that high, but a good amount. We just do a sprinkle amount, little bits here and there. We wait for it to stimulate collagen, then we can put a little bit more in there, and it just looks really natural. Antone is saying, how and when do you use spironolactone on your patients? I do a lot actually for women. I don't do it for men because you can get gynecomastia with men. But for women, like I do a lot of it actually because it's an excellent medication. It helps with oil production. And it's something I try to do just because it doesn't require lab work like regularly or anything like that. Vast majority of women tolerate it really well, and just there's other side effects that are actually good for you. It's actually cardioprotective, so in the long run, it's actually good for your heart. Things like that are actually helpful for people. So that's why I recommend it actually a lot. How much Bellafill was this? So basically, we did 1 vial when we first did the treatment, and then we did 2 more vials after that. Let's see here. Tichan is saying, I'm not sure if the silicone tape is helping much. Can I stop it for that little bump that you had? That little cyst. You could stop it for a little cyst, and then I could take a look and see about lasering that away for you at some point. Birdbash is saying, the cheek filler that I'm trying to dissolve is in lateral cheeks because they tried to make cheekbones. Is it easier to dissolve because the voluma is in the lateral cheek? I'm not sure if it's easier to dissolve. Voluma in general is really difficult to dissolve. I'm not sure if it's easier to dissolve. It's tough to say. I'm up is saying, are patients going to have to come back years later for a touch-up? Once again, amazing results, such an awesome thing to see. By the way, hello again. Well, I'm up. Appreciate seeing you. Patients can come back. Yes, a lot of times they do. It depends on what they're trying to achieve. The patient I was referring to earlier who drives like 3 hours or so to come see me, he's trying to get close to his perfect look as possible. He just really felt that he was robbed of how he was supposed to look. He had a peel that just destroyed a lot of his skin, and he's trying to achieve like that look for himself. And so I see him regularly for that purpose. But some people, like, they just do a few sessions or so, and they're fine in life. They don't need to do much more. You see them walking around or see them at like a wedding or something like that. They're super happy. Everything's great. It's like, awesome. We got it. We got you where you need to be. You're at peace in the world. I'm at peace. It's awesome. I just want to walk away with this whole thing. Just feel like I did a lot with these with scars. A lot of things that I did with whatever I was trying to solve. And wherever I run into patients, I'm going to be really, really happy and feel really comfortable. I just want that. I want to be able to feel really relaxed. I'm not like going to be like somebody that like is just like going to sit like on an island. I really like people. I like to like hang out with and talk to people and things like that. So it's like, last thing I want is just to have a problem where people didn't get enough results. It's really important that everybody just ultimately achieves their best look, and it's achievable. It's really nice. I had so many follow-ups today, and people were just like super excited. Some patients I hadn't seen in like several months and stuff like that, and like they're trying to do some more treatments with me, and it's really fun to see like just that their skin quality is better. You can see, and everybody universally says it's slow. It's like we see those. This patient though, she had rolling scars. Rolling scars though, you do see that result a little bit faster. She had those thick edges. You see that a little bit faster. Ice pick scars take a little bit longer. It could take a little bit longer. can we also consider, or T China saying, can we also consider steroid injection, or do you recommend laser? I'll feel it to see if steroid injection is good for us, but usually laser by itself is all we need to do. But maybe I'll put a little bit of steroid within the laser channel holes that I do see, but I'll see how inflamed it is, see what we need to do with it though. Medi Glow is saying, do you prefer hyperdilute Radiesse or Sculptra for volume loss? How do you decide which one to go with? Hyperdilute Radiesse is better for more skin laxity issues. I don't think it's great. It's not very robust for volumization, but it's great for skin laxity. Really, really good for that. So you want the elastin production, collagen production. It's going to make it a little bit more tight. So really good in the neck area, for example. Sculptra, better for volumization. It's better for like just giving a little bit more of that robust volume effect. So really good for like sunken, hollow cheek, temple area, those type of areas. It works really, really well for that. It just becomes a matter of preference then for what people are comfortable with, and also just in terms of like how loose the skin is. If the skin is a little bit loose, I do prefer more like Radiesse then usually. What can I do about nasolabial folds? They're getting deeper, but I've had them since childhood. Yeah, you probably aren't going to be able to do too much if it's more like the genetic fold. Like a lot of times that's just like something that's just pulling down a bit there, and you're not going to be able to do too much with that. I usually like Bellafill though. I do like that because it's a collagen producing product, so it's actually just going to support that area, and you can still animate your face. It doesn't look stiff or anything like that. And someone was asking about marionette lines. Actually, Bellafill works really, really well on the marionette area as well. Do that, and also do like just light fillers as well. Thank you, Sigma. Appreciate you coming on. Why won't you answer what treatment this is? Actually, I answered a few times. So I come on at 9 p.m. from Monday to Thursday. I'm actually the tail end, actually over what I usually spend on time for here. But I'll go through it, no problem. So for those just joining, this is an acne scar treatment as a patient Fitzpatrick 4. And the way I did this was I did TCA Cross, I did Subcision, where I went, so TCA Cross is an acid I placed at the base of each of those scars. And then I did Subcision, where I went inside there and broke up the scar tissue. And then I did ablative CO2 laser, fractionated laser as well. And it worked on doing that really, really nicely for her. Celebrity dose of isotretinoin for large pores, your opinion? Well, it's really, that's microdosing of Botox. Botox you can microdose too. That's microdosing of isotretinoin or Accutane. I do a lot of that. I'm actually a big fan of that. If you could tolerate it, it's great. It's just like a low level, once or twice a week. Just depends, on how much oil production there is. Depends on what other things you tried. And if you've had problems with Accutane in the past, things like that, all those are factors that we have to look at. Otherwise, we use the Cure laser, which is excellent. Works just like Accutane. It's nice because for the moderate to severe case where you normally would have to go a higher dose for Accutane, we could just use the Cure without those other side effects that people may have with a higher dose. What are stem cells good for? Good question. Good question. I don't know. I think it's good for, like, if you get it from your fat, you could help with some of the scars. You could inject the nano fat in there probably. But I've never done it by itself just for that purpose, because I think it's like an invasive procedure to be able to get that. And then you're just getting the stem cells there, which I could get that kind of improvement when I'm doing these kind of treatments without stem cells and just a costly, more invasive procedure. But if we're doing fat transfer on the patient, then yes, I would do those stem cells with it as well. So stem cells, though, exogenous stem cells, the ones that are made, I would be skeptical, to be honest with you. I would be really skeptical. I'm still really skeptical. They hardly show any studies. They hardly show any real results. It's, we learn so much now about how shady and sketchy so much stuff is now with the dyes that we have in food, all the stuff that they've been poisoning us with in our food supply. And I'd be concerned, that was stuff that was supposedly regulated, and stem cells are not regulated. It's they're not approved. They're not even approved. They're actually, the FDA put a letter out that said don't do injectable stem cells. And there's people out there that are pushing IV stem cells and stuff like that. There was a doctor over here, he lost his medical license actually, and he was trying to talk me into you should do stem cells, blah, blah, blah. And he's got all these stem cells and you could charge $10,000 and all this stuff. I was like, I'm not doing any of this garbage. What is this point? What's the point of any of this stuff? And then it's super sketchy stuff like that they're claiming would cure cancer. And at one point, some of these guys were claiming it was going to cure COVID, all that stuff. It's just such nonsense, honestly. It's really nonsense. And you got to look at this stuff and be really pay attention to the things that potentially could cause long-term consequences. and that's what I'd be worried about. Thoughts on salmon DNA? I'm open to it. I don't know if it's effective really for scars. I think just like overall skin rejuvenation is probably good. It's not FDA approved in this country, but we could potentially take a look at it because there's enough studies out there really with it, or like enough of a safety profile that will probably be okay for it. But it's not something that I think is going to be solving scars. I have a lot of patients who've tried it and they didn't really see much improvement at all with scars. So not something I would push really. Thoughts on Ultra Clear? I'm open to it, I guess I would say. It's just like another device, but I've had patients who tried it, didn't really improve too much. I'm not sure if that's really enough to say if that's like, I could write off the device for that, but I've talked to other physicians, things like that they haven't been too impressed with it also. But it's possible just the way people use it. I haven't used it in my hands or anything like that, so I can't really comment on it that way. I'm open to it. At some point, maybe I'll take a look at it. It's, my whole thing is I'm not really like a big person who just jumps at different devices though, really. I just don't do that way. So I wait to see if it really is going to make sense for me. I will tell you that a lot of the stuff, I'm not necessarily talking about that brand per se, but like a lot of these laser companies, they'll use the same influencer doctors to really push their devices like over and over and over again. And it's really suspect a lot of times the way that they push stuff, that physicians that they're using sometimes, they have like almost no results, and they claim that they do this stuff all the time. The studies are just really poor studies, stuff like that. So I get really concerned with a lot of that stuff, to be honest with you. And I've gotten tricked many, many times by these device companies and the physicians that work for them. And it's, concerning. And I've had patients, like right here in the chat, people were saying, one person on here was saying that they did Clear and Brilliant and it didn't work for them. And they did multiple sessions, it didn't work for them. And it's unfortunate that kind of device is pushed for scars. It really is. Hi, Zamora, how's it going? I know it's really late for you. Good seeing you on. Appreciate you, by the way, coming on. Everybody should click her profile, just in case you haven't, though, and just see what her video is for scars. Is really, really interesting. At some point, I'm going to circle back and we will work on treating Zamora. So you heard that here first, actually. And I don't even know if I told you that officially yet, actually. But at some point, we're going to work on you. We'll figure it out, though. But now that I saw you on here, I know it's really, really late at nighttime, so I'll let you know that there. What treatments do you recommend for PIH? A pico laser works really well for that. Pico laser is really, really good. Can doctor inject jawline with Radiesse if I have a chin implant? Been 3 years since implant, but it was put in. Not necessarily. You probably don't want to go down to the bone with that unless you know exactly where it is. You could take a look with the ultrasound to see where it is. But we may not go deep to the bone with that. Actually, sometimes it's going a little bit more superficial to it. Maybe an idea for depending on what it is. It depends what it is. I appreciate you. Zamora, I appreciate Zamora saying that first time I'm hearing it, I'm crying about it. And I liked your video a lot, and I really felt it. I really, really did feel it. And so we'll talk at some point. My team will reach out to you and go through everything. But it is important, really, to do as much as we can with as many people as we could. So I'll work on it. We'll help with the people that are suffering out there. F. Del Mar is saying Tazorac generic, the same as Fabir. You're just mentioning FYI. I missed that FYI portion of things. Can you do this treatment if you're on low dose Accutane? Yes, you can. Depends on how low dose and depends on your acne and oil production mostly. Do you do online and in-person consultations? We do both. You could just go directly on my page. For those that don't know, you could go directly on my page. Almost everything's on our page. Our prices are on our page. You could go on there and actually just schedule a consultation that way. What about punch excisions? So punch excisions, I did a really, really good case today with punch excisions. Awesome, actually. He had the perfect ice pick scars for punch excisions. Really deep. He said there were huge cysts. He remembers when there were cysts. They blew up, caused this big pocket right there. Perfect case for punch excisions. So I did that actually for him today. Multiple, actually. I had to keep on doing a few of those there. So it depends, like how deep how deep and thick the scars are. Boxcar scars, you could do it as well. It just depends on what we're looking at, how deep those scars are. But absolutely, they could really be great if it's in the right spot. You definitely want to make sure that you're not doing it along certain areas, especially when it's perpendicular to the scars. Doc, what's your secret for the great energy you have? I can't even talk after 5 p.m. That's a good question, actually. That's actually really good. I don't drink coffee, actually. People are really surprised by that. I never drink coffee, actually. I don't drink any coffee. I don't know. I think that it's just a lot of training. Like when I was trained, like when they trained me, it was like, I worked at a Cook County hospital, and I just did a lot with that over there. I worked at another community hospital. I did a lot of things like that, and it was like we worked and we just kept on working. We had to think really high level stuff when we were working there. And I think that really did help a lot, actually. So training actually was a big deal. But also, just in general, I like what I'm doing. And I like talking about things that I do. And so it's fun, so there's certain subjects I like to talk about too. It's I could keep on talking on and on and on. And so this is one of them. I like talking about scars. I like talking about the consequences of scars. I like talking about the socioeconomic consequences of it, the reasons why people get scars, all that stuff, the psychology of it, because I think it goes into multiple different subjects. It's not just a one thing. I think that this really does affect people in a certain particular way, but you could start navigating the healthcare system, and you start seeing it with when you have acne, when you have scars. You see it and you feel it, and you understand really how it's really terrible, and it's unjust, and it's unfortunate, and it's I think it's interesting. I think it's really interesting because we have a community. It's not about left or right. Everybody's so obsessed about left or right. It's not about that. It's about people are suffering out there, and it just the system just has to be better. And it doesn't even matter. I don't even care however you guys want to solve it. It doesn't matter to me. It's not my job to solve it. I'm doing my job. I just want the people in charge to solve things better. I don't even care how they do it. I just want people to solve things. And so it's I'm solving my problem. I was I'm going to go into this world for acne and scars. I want to solve it in a really, really high level. And I'm doing it over and over and over again. I just want the people in charge of us to do the same thing that. They're not doing their end of the bargain in this. I pay an enormous amount of taxes, an enormous amount of taxes. And then there's all these fees, all this stuff. And I'm just not getting my end of the bargain here, at all. The education system sucks in this country. Healthcare system sucks in this country. Foreign policy system sucks in this country. The roads suck. It's just so many things are just garbage. And it's I do my stuff at a high level. Why are they not doing their stuff at a high level? I don't even care what side of the aisle you're on. Everybody can see that things are just garbage. And so it's you, I'm sure, are doing your part in whatever world you're in. Even if you're not doing it at work, you're doing it at home, you're doing something, you're taking care of something, and you're doing things at a high level. Why are the people in charge not doing things like that? That's what they're hired to do. And that's what I look at. It's it's just ridiculous to me. Whatever you do it at a really, really high level, or just don't do it. Step aside, and we could just rule ourselves, to be honest with you. I think that we're capable of doing that. We don't need this type of issue where these guys are just garbage on top of us. They don't care about us. And they come in there with they're worth $2 to $5 million, and they're leaving there worth $150 million. Make that make sense. They're worth $150 million afterwards. They were worth $2 to $5 million when they started, and they're worth $150 million after. And I'm telling you, they're not some stock prodigy. They're not sitting there just these prodigies at stocks. So just put two and two together there. It's there's a lot of stuff that's out there that just doesn't really make sense. And it's time to wake up. And imagine somebody saying, oh, I'm going to do scars, and I'm dedicated to do scars, and over and over and over again, they're just sucking at doing it. It's maybe you should do a different field. You should do something else. Or you're going to a physician and just garbage at that. And it's maybe you should work on something else in medicine, or just go do something else in life. And instead, we have these guys who are these career politicians who are in their 90s, literally in their 90s, and they've never done a single thing that was great ever. And it's what the heck, what is this? Why are we accepting this as a nation? Why are we doing this? So it's I don't understand it. To me, it's I do my stuff. I just want to relax. My goal in life is just to relax and do my things, whatever I want to do. That's what I want. I want true freedom, just work on people, help people, do these things, talk to people, and just enjoy my time, my family, all that stuff. And it's just you work, and then you get all this tax, and for what? I don't understand what we're doing. I don't understand it. It's just outrageous. The amount that we have to put, there's nobody out here who should be supporting, to be honest with you. Chelsea's saying, what would you work with scarring and hyperpigmentation from, or what would work with scarring and hyperpigmentation from popping acne? That's what I was showcasing over here. That's a few different things. She has both scarring and hyperpigmentation. So we had to do Subcision, we had to do CO2 laser, we had to do TCA Cross, we had to do some filler, And I also worked on her pigmentation with a little pigmentation cream, so it all helped with that. Can you repeat your thoughts on a tattoo pen, please? I'm really against it. I'm not a fan of it. It really could cause more hyperpigmentation there. Vic, how's it going? Vic is saying it's time for change, and we hope that these next 4 years will be better than the last. Peace, love, and prosperity for all. So far, it has been getting better. I'll tell you that. It's not. I'm happy with. To me, like I said, it doesn't matter right or left. I just want things to get better. And so far, what I'm hearing, things are not getting better. So it's like, I don't know. I don't think that we're going to have to really be trusting politicians to make our lives better. I think it's going to be you and me and people on the ground who actually just like suffer from anything and who look at things and think that this suffering doesn't make sense and we need to come up with some solutions. And it turns out there's a lot more of us than people expect. There's a lot more people who actually care about this world. There's a lot more people, and it's not like what everyone says. It's not as selfish and cruel and like terrible of a world. It's just that the people in charge are that way. It's not the world, actually. It's just that they try to make it that way because they're trying to make it seem like it is that case. It's not. Actually, the world is actually like, people are actually great, actually, when you talk to them. You just listen to people and they're actually great. They have great vision, great stories, great time. Like they want to do a lot of great things in there, and they're crushed. They're prevented from doing those things over and over again. And one of the things is like I'm trying to help with is this part, because this could prevent people from reaching their potential. Like scars could do that to people. They don't achieve what they want to achieve and they get stressed about it and they're worried about it. And it's like, I want them to achieve everything. I want everybody in this world to achieve their highest possible potential. Everybody has a higher potential than they realize. Every single person out there, they have a higher potential than they realize. And if I could help them achieve that higher potential, that's going to be like a really, really happy moment in my life. And so today I was really happy. Today was a really, really good day. I had multiple people who I worked on and I saw the follow-ups and it's like, it's really, really awesome. I'm looking at it, I was like, this is really good. So with that, I will be off for tonight and I will see you again on Monday night. We'll see what we